Hello everyone, I'm Kibin Alleyne and today is Tuesday, January 30th. You are now watching Open, a program that brings the Bronx and New York City straight to you. Don't forget to stay connected with us via social media at BronxNet TV. In 2021, Montefiore Einstein launched a Community Health Worker Institute exploring the impact of social determinants of health on overall health outcomes. Social determinants refer to non-medical factors such as housing, social policies, racism, climate change, and more. Renee Whiskey-LaLanne, Associate Director of the Community Health Worker Institute, joins me to discuss how this program addresses these issues. Renee, thank you so much for joining me.
Thank you. Thank you for having me.
Now, the Community Health Worker Institute launched in 2021, as I mentioned, addressing the social determinants of health. Can you just explain what events inspired the effort to actually create this program?
Yeah, I think the interesting thing is that community health workers aren't really new to healthcare. They aren't new to the Bronx, and they aren't new to Montefiore. What we're really proud of is this institute was designed as a way to optimize how we're working with community health workers. How do we find the best ways to identify local talent, to train community health workers, to professionalize them in a way that allows for their career growth, but also how to effectively have them work with our community members and with other members of the clinical team.
Now, we've explored social determinants of health on the show before, and I'm so glad they were actually kind of exploring it a little bit further because it's so important. You kind of mentioned that this has always been something that healthcare professionals have looked at, but can you just talk about maybe when did society or, when did the larger frame of healthcare workers realize that this was a huge factor in health outcomes for many people?
Yeah, I think, what we know is that if you're taking a overall look at someone's health, we've known for a while that only 20% of someone's health outcomes are directly related to quality access to care. But that leaves 80% that really is a system or net of other factors that influence health, and we've known that for a long time. The interesting thing is that COVID really highlighted the conversation and pushed the mission forward in a way where information is flowing direct to community and back up. And so it's really just a new approach at really thinking about the whole person and how we can address people's needs from different aspects.
And I'm really glad you brought up the fact that COVID kind of helped, kind of put this to the forefront, because I think that's when I started learning more about this. But with that being said, social determinants of health are still very understudied. What impact is this having on marginalized communities specifically?
Yeah, so there's a lot that we don't know, right? The landscape changes frequently, but one thing that we've learned at Montefiore Einstein through doing this work is data really informs a lot of our decisions. We don't make assumptions about what our community needs, we ask directly. And so when patients come in for care, we're asking them directly, are you worried about some of these issues like housing quality, like food access and legal assistance, things like that. And once you know that information, what do you do with it? And so we're able to really take that information and apply it to how we train our staff, how we address social needs. We have a whole research team that allows us to inform the decisions. So we're learning lessons as we go and making changes to improve patient care overall.
Now, how are social determinants of health affecting how health professionals connect and care for their patients?
I love this question. I think it opens a deeper connection with patients and community, but also on clinical care teams, right? And so when you're working with doctors, nurses, social workers, and community health workers in a team, everybody has a different role to play, but everybody's role also enhances the other to the benefit of the patient, right? So if you go to see your doctor and your doctor asks you about your needs or challenges in these areas and asks you if you want help, they can focus on the things that you're there for clinically, like your hypertension, maybe your diabetes, and then say, you know what, there's another trusted member of my team who can help you get connected to more food, to more affordable housing options, to help you address the mold in your apartment. And it just allows us to work collaboratively, again, for the benefit of our patients.
And the way you explained it just now, I feel like it just paints such a clear picture because doctors they have so much on their plate when it comes to serving communities, especially marginalized communities.
course.
And so I can imagine that it can be difficult to help, address the health aspects of what that patient is dealing with and then all the outside factors. So can you just explain a little bit, why having these workers kind of assist doctors is so crucial?
Yeah, I think it's really crucial because, again, community health workers are really local experts, right? So we're looking for people who are a part of the community, who understand the unique challenges, who know what it's like to go down to CBO on, 161st Street or 178th Street and to navigate what they're going to face when they get there, right? What application do you actually need? What documents do you need to bring? We can't expect our doctors, our nurses, and everyone else on the care team to be able to think about your medication and also think about what you're going to face when you get to the community center or the agency that you need to get to. And so these local experts, embedding them on the team, really brings the community context to the conversation. And it just enhances what we do at every level, I think.
And how does the organization actually find these type of healthcare workers?
We partner, right? We partner with community-based organizations. Word of mouth is our best referrer, but also with healthcare entry-level programs. So there are a lot of community members who are looking for ways to be integrated into healthcare jobs and healthcare careers. And this is a great entry-level position. And so we work directly with those programs, with community-based organizations, and our community health workers also refer, right? They know who has the pulse on the community, who knows the resources, and can bring their lived experience to the table.
I think it also helps add with that trust because, as we know, in many marginalized communities, there's often distrust when it comes to just healthcare, and people are sometimes afraid. So I think that having this like people from the community helps build that trust and kind of helps people take that step forward to learn a little bit more. Now, the New York State Department of Health awarded Montefiore with a grant to help address basically this overall issue. Can you just talk a little bit more about that achievement? Congratulations, by the way.
Thank you, thank you. We're very grateful for this funding opportunity. The state has given us $2 million to enhance how we train and support our community health workers. What that looks like for us is nationally we know that most community health worker programs, the community health workers get roughly about 80 hours of educational instruction and perhaps maybe 80 hours of on-the-job training. What we've been doing over the last year or two is really enhancing how we do that and how much training and professional development we can provide. And so through this funding, we're actually just kind of trying to optimize how we do that. So we're looking at upwards of 160 hours of educational instruction, but also this on-the-job 2,000 hours of supervised time for patient engagement. What that allows us to do is really marry what are the skills you need to be successful at your job, but also what are the foundational things you need to know about public health, delivering healthcare, engaging with patients, and of course, professional development, right? We're looking at this as this is an entry point into health careers, but this is not your end goal, right? You want to be a community health worker, but there are places to go after that. Your career can grow. You can become the next social worker with all these tools and skills that you've developed from our training program. So this is going to allow us to do that for at least another 16 community health workers.
Now, I really wanted to highlight that because not only is it, helping community members with their overall health and social determinants of health, but it is providing, access to career mobility.
Yeah.
He talked about just the importance of kind of having both of those things.
Absolutely.
In so many communities where we do see a lot of I guess a lot of the people in these communities are marginalized and they are facing a lot of these health issues. But when it comes to career mobility and advancement in careers, there's also a struggle there as well. So can you talk about the importance of having both of these things available?
Yeah, training is one aspect of a job. Everyone should be trained to do their job and do their job well. But it's this coaching and mentorship model that we're developing that allows us to really identify where do our community health workers see themselves? Where do they want to go? how do they want to grow? And it's our job to invest in them in that way. And I think at Montefiore Einstein, we're really invested in investing in our workforce. It doesn't help us to keep someone who's really great as a community health worker, for forever, right? They can be the next great nurse, they can be the next great doctor, they can be the next great social worker. And so it's our job to make sure that we're helping to guide and mentor them on that path. And through this training program, we'll be able to do that.
Now, as you mentioned, I think this is a great entry point to, having a legitimate career in healthcare. What are maybe some qualities or some things that a healthcare, worker in this program should have?
Yeah, we want you to be someone who's personable, someone who's eager to learn, who's flexible, who knows how to work with people really well. A lot of this, you hear a lot of challenging stories all day. And you have to be able to, one, be empathetic, but also to be a partner with a community member or a patient in trying to find a solution to whatever challenge they're facing at the time. We want to respect people's resilience. We know the Bronx is extremely resilient, and our patients and our staff, they bring expertise to the table. They can tell us, hey, we went down to this office to do this application. The process has changed. And so we take that information and we go back and we figure out how do we improve getting people connected to the service. And I think we do that on an ongoing basis. And we just need people on our team who are willing to be flexible in that way and to partner with communities in that way.
And what is the application process like, or just, the entire process of actually becoming a part of this community?
Sure. So our community health worker positions are posted on the Montefiore Einstein career website, like all of our other positions. You can apply. It's a competitive application. You're scheduled for an interview, and then we kind of spend that time getting to know you and what your expertise is and what lived experience you bring to the table. And then if you're offered the opportunity, you start training on day one. And we're very proud of that because we look at it as the day you get here, you should be learning what it's like to do this work.
Now, I think this is an amazing program. As I mentioned, it was out since 2021. So, I can only imagine how much more it will evolve and serve the community. And especially since, as I mentioned, in so many marginalized communities, we do have some issues with health. I think it's amazing that we have organizations like Montefiore kind of putting in this work. So I appreciate you taking the time to come speak with us and kind of educate the community about what's going on.
Thank you. Thank you for having me.
To keep up with all the amazing work that Montefiore does, please go to their website at www.montefiore.org. Don't go away, we'll be back with more Open right after this.